Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care. Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the opportunity to sit down with Dora Barilla, who is the co-founder of HC2 Strategies, an organization that started in 2015 and has become really well connected with managed care organizations, which are also known as health plans, and the state of California's Department of Healthcare Services. In today's episode, Dora talks a little bit about her upbringing, how her father and husband were inspirations in much of the work that she does, and how now she serves as a facilitator with health plans and providers throughout the state of California with a big focus on the CalAIM initiative. We hope you enjoyed today's episode. Check out other episodes of Pop Health Podcast by visiting us on our website, pophealthpodcast.com, checking out our YouTube channel, or listening to us to wherever you listen to your podcasts. Thanks, everybody. Enjoy today's show. Dora, thanks so much for joining the show today.
My pleasure, Gavin. Thanks for having me.
Absolutely. Really appreciate it. Folks, Dora is taking a little bit of time off in the near future, and she was kind enough to squeeze me in. Although you'll probably be working while you're on vacation, knowing the little bit I know about you.
It's all work-life balance, right?
So, Dora, one of the things we like to do to start the show is get to know the guest a little bit. So can you share something with our audience about yourself, something outside of the healthcare world, outside of the workplace?
Sure. Well, I'm a fifth-generation Californian, so absolutely love California and really long-term roots here. I love the mountains, I love to hike, and I love math.
Math?
Yes.
So when you say you love math, so you like just numbers in general, or do you like actually do any math?
Well, kind of a story behind that. My father, he was in his 40s when I was born. And so he was in the military before I was born and for about 20 years. And he ended up at Edwards Air Force Base. And he was actually there when Chuck Yeager broke the sound barrier.
Oh, cool. And
so my dad never talked about any of the horror traumas of, he was in World War II and in the front lines of the Korean War. And that was some serious trauma. What he always talked about was how he worked with the team to break the sound barrier with Chuck Yeager. And he was just a part. My dad was a machinist, so he would draw math problems, even at our home. And he used math as to say, you don't know what the answer to the problem that you're having now, because you just haven't figured it out yet, but it's there. And he would have math problems. So math to me was really how do you look at the world and how do you solve world problems? So not just numbers, but really looking at possibility and, kind of breaking the barriers of what a human thinks that they can or can't do.
That is very neat. Really cool. Thanks for sharing that story. So let's learn a little bit more about you, Doris. So I know we have a connection with the 626, and actually our last guest also had a San Gabriel Valley or 626 area code kind of connection, which was Martha from HealthNet. So tell us about your growing up in the 626 and walk us through up until college.
Yeah, it was actually 213, Gavin, years ago. They've changed the area code many a time since then. But yeah, no, you don't ever forget your first phone number, right? But I was born and raised in South Pasadena. Again, I came from a family of 5 girls, and my dad really valued education. And so South Pasadena had an excellent school system. And, knowing he couldn't afford to send us all to private school, we grew up in South Pasadena and absolutely loved it. It was, I was there, I lived there my whole life and, moved away to college after South Pasadena, but it was just a great community.
Awesome. So the 213, I think I was in the 81. I grew up in Azusa.
Okay.
The other side of the San Gabriel Valley. And at one point, I think we were 818 out in Azusa. I don't know if South Pass ever did the 818 as well.
Parts of it. Yeah, they broke through, and then it was 323. So 213, 323. I'm aging myself. So, and 310. So yeah, I've been through a lot. I'm old enough to be through a lot of area codes.
Funny stuff. So after high school, you went off to Pepperdine, and I believe you studied sports medicine. Tell us about that inspiration and basically how you ultimately ended up in healthcare.
Yeah, so I always knew I wanted to work in healthcare. I, just probably thought maybe I wanted to be a physician or I wanted to work in healthcare, but I was really interested in prevention and wellness. And so I went on and got my degree in sports medicine. I didn't even know what public health meant. Everybody was a doctor or a nurse, right?
Yeah.
And sports medicine seemed to be a much more interesting foundation. And I loved it because to me, it was, exercise was medicine. And that's really how I viewed, again, growing up in South Pasadena, you really saw how an ecosystem of a healthy community can really help people thrive. You can thrive or you can, really have some challenges. We were right next to LA. What differentiated South Pasadena from downtown LA? And, it really was the ecosystem. And we had great running trails. We had the first Trader Joe's, it was, that's where we grew up. And so just the thought of health and wellness, was really interesting to me. And I can share a little bit, kind of that journey that it wasn't only about health and wellness. As I graduated from college, that's when managed care, again, I'm aging myself, what managed care was first coming out. And I was the director of a managed service organization when managed care first came out, and looking at how do you manage kind of this, what we're doing with CalAIM today is really looking at what are the community conditions and, for people that are utilizing a lot of healthcare services, and really realize it had very little to do with clinical care, but it had so much to do with your social connections, the environment that you lived in. It's not that you were lazy or you weren't eating right, but perhaps you didn't have sidewalks. Perhaps you didn't, your palate never knew what healthy food was. And so, just that evolution from really having that base and that foundation of what good health is to public health of what are the conditions that we need in order for everyone to thrive. So that's really kind of my entire career was really based on that aha moment of, it's not just about clinical care or eating right and being and exercising, but it's really about the communities in which we live.
Yeah, well said. So for those just taking a step back, I mentioned Pepperdine. For the audience that may not be familiar with Pepperdine, it's a pretty well-respected university up in Malibu, California. Dora, I actually was at a retreat there about 2 months ago with my son and his youth group. Which is a faith-based youth group. And you had mentioned off the air about some of the work that you do with faith-based health systems. Can you briefly touch on that as well?
Yeah, again, looking at what are all the conditions that really, create health. And just my foundation of Pepperdine, and then I went on to Loma Linda University for my graduate degree, and also I spent a decade at Loma Linda University Health. It is just what's the faith component, and I don't mean it from the faith component in terms of fundamentalism or but really what is it that in your path of faith that helps create healing? How is it that we can activate faith to really be an asset for not only yourself, but also for communities? I mean, if you look at the basis of community support and you look at, where some of the communities where people really thrive, it's because they have a social network, and always been really interested in that. So I've been involved with a group called Stakeholder Health. And it is an organization that, we started in 2011. Well, it's really not an organization. It's a loosely organized collaboration or a community of practice from health systems from around the country. And we actually had our first convening at the White House with Health and Human Services. And it was Gary Gunderson is my co-chair who started Methodist Le Bonheur. And they actually had a congregation health network where congregations were actually providing a lot of like the community supports that we're talking about. Yep. And how can they wrap around people that, might not have that, that support system when they're either in the hospital or they're being discharged from the hospital. So it really is, I think a really powerful organization of people that really care deeply about reactivating faith in our world today so that we can provide healing. And one of our mottos is, being our most mature faith combined with the best science.
Wow. That's pretty deep, deep statement there. So you mentioned basically faith-based organizations providing a lot of the community supports. An example that I can think of would be like churches providing food banks, which a lot of CBOs, community-based organizations, maybe not faith-based do today. But I grew up lower income. I was fortunate to, my parents always had a roof over my head and generally had food. But there were times where I received, the church provided food for my family. So that's a really good point. So I want to touch on something that I read about you, and that is your husband and a traumatic brain injury. Tell us about that. And you actually wrote you wrote about it. Tell us about that.
Yeah, just kind of one of those really life traumas. In 2005, my husband, who was a firefighter paramedic at the time, was responding to a call on the 10 freeway and hit by a tour bus and wasn't expected to live. He was airlifted to the local trauma center, did a neocric in the air. And by the time I got to the hospital, I'd, worked in hospitals since I was 16. They were going to tell a wife that she was going to be a widow. I had a 7 and 10-year-old daughter at the time, and was just really devastated. But really, all the things that I believed in, I learned: prevention, wellness, faith, community connections, and the belief in what's possible. Going back to my dad, that what can the human condition do? He actually lived, Gavin, against all odds. No one can explain it. He had a craniectomy within an hour, not only lived, but went back to work in a year.
Wow.
So it was actually his neurologist that asked me to write the book. It was everything that I ever believed in, everything I've ever practiced, all the, just the life lessons put into that book and into healing my husband. And so I just have a real strong passion. That's kind of what drives my work is, how can we make that available to anybody? Not that everyone's going to live through every trauma.
Yeah.
How do we, activate the best in ourselves, in our care teams, and in our communities to get the best outcomes?
Is that book available? If people hear this or watch this and are like, hey, I want to learn, I want to check that out. Is that still available or?
Yeah, they can go on P4BHealth.org, which is a not-for-profit organization that receives all of the proceeds, and order a book on P4B Health.
Okay. What's the name of the book?
A New Day.
A New Day. Okay. Awesome. Thank you.
Mm-hmm.
Okay. So let's jump into HC. So folks, I've known Dora through some collaborations just recently. I don't know her well. To be upfront, I don't even know how to pronounce your name correctly. Shame on me. Is it HC², HC2?
Yeah. So it's HC2, and it's Healthy Connected Communities.
Healthy Connected Communities.
Yeah.
Tell us about how you decided to become an entrepreneur and go at it on your own when you've had a pretty solid career prior.
Yeah. So, again, that passion of, what does it take to really create community? My business partner, co-founder Rick Rawson, and I were both working at a large health system. He was the VP of strategy. I was the AVP of, population health and innovation, and really looking at, how do we how is it that we activate health systems to really engage and be involved in this movement of, looking at population, whatever you want to call it. I call it the health of the public. How do we improve the health of the public? And really saw that, health systems had a role, but it really needed to be that connection between not only health systems, but public health community-based organizations. And how do you create that, the community conditions? So HC2 was formed in 2015. And really with that whole premise of how do we work together to really activate health and to create those ecosystems so that everyone can thrive.
So when you had this inspiration, I guess you were the brainchild, if that's appropriate to say. Did you have clients when you started, or did you start the business and then just start working with your network? How did they get started?
Yeah, well, both Rick and I had, we'd been in the field for a long time. So, so we actually had some of our health systems that had been, we'd been working with, contracted with us. And, it was a savings for them. So those were some of our initial clients. And then it just exploded, quite honestly. Because of our reputation, our commitment to this work, we were very mission driven. We took that, the values and what we believe in faith and, really applied it to our business model, that we didn't want to be, nothing against, massive for-profit health system, consulting companies, but we wanted to be different. We wanted to be really organic, mission driven. We didn't want to be large. We wanted to be authentic and really partner with other small consulting companies that were values aligned. And so if anything, we've had to halt work because we didn't want to grow for the sake of growth. We wanted to grow for the sake of impact.
Wow, good for you. So speaking of being busy, I guess CalAIM obviously is this huge initiative. We've talked about it a lot this year on the podcast. Tell us how you got connected to CalAIM, and if you can also walk us through, is the state your client, like DHCS? Are the health plans? Like, how does that all work?
Yeah, well, it's really kind of a lifetime of, from the time I was, a young girl, just, I think I've been preparing for this, but, it's a part of my DNA. But, what Rick and I, when we first launched our company, were working with the Hospital Association of Southern California. Okay. And we helped launch Communities Lifting Communities, which was a community health initiative with the hospitals, public health, and other community-based organizations and Medi-Cal managed care plans to say, how do we address diabetes? How do we address, those that are unhoused, knowing that so many community conditions. So we launched that, I think 2017, 2018, and really just did it, because it was the right thing to do. We worked with, all the different counties within the Hospital Association of Southern California region. So that was kind of our starting point, and had made connections with all the managed care plans. And so when, CalAIM came in through the managed care plans, they actually reached out to us and asked if we would be a part of that. So, it was a logical connection and fit, knowing that this was really what we did. We did it before it was even something to do.
Yeah. So does that mean, go ahead. Sorry.
Well, so if you're looking, we've been pushing to advance and innovate Medi-Cal with exactly this lens. So it was really exciting to see it actually have funding. We've been doing this for years without funding. So if we can do it without funding, imagine what we could help do with a little funding into our communities.
Yeah, that's great. So then are you guys funded by the MCOs or who are getting money from the state, or are you funded by the state? Like, who is technically your client on paper, I guess?
Yeah, we always like to say the community is our client, just in terms of right now we're working with the managed care plans and helping to facilitate, and we're that neutral party because, it is just really unprecedented, the collaboration between the health plans. They, you can say a lot of things, but just the collaboration that's happening is profound. And they needed a neutral party that kind of knew this space. You can't be a novice and walk into this because there's so many unknowns and so many around the corner. So, we were just thrilled to be that facilitator to help create the conditions for this to be a collaborative model.
Nice. So let's talk a little bit about that facilitation. So I've participated in a lot of these roundtables that are happening throughout the state. Can you talk us through, for the audience that isn't familiar when I'm saying roundtables, what are they and how are folks collaborating in them, I guess?
Yeah, so a roundtable are exactly that. How do you create a transparent, open process for people that are providing either community supports or enhanced care management to come to the table to learn what is CalAIM? A lot of people have asked what CalAIM is. I always like to say it's advancing and innovating Medi-Cal to really serve those most in need. And I know that there's a lot of moving parts to it, and people think, kind of feel a little bit overwhelmed. But I always like to stay focused on what we're trying to do. And so the roundtables were to create that setting. How do you have that neutral setting? I mean, what we've been charged to do is to create the table. So, that's step one. Hopefully people feel that it's an engaging place. It's a non-judgmental, so that we can do continuous quality improvement on one, getting some of the dollars out there, identifying what the priority needs are. And then really what we're working on now, Gavin, is to do network development. How do we get, the ecosystem and the infrastructure, not only to support the community-based organizations, but also the ecosystem of data exchange and, so that we all know how to do this. I said my beginning career was in managed care, in the late 80s, early 90s. And, we kind of saw the same thing with private providers. They just didn't have the infrastructure.
Yep.
And so how can we help create that infrastructure for community-based organizations that have really been providing the support to the communities for a long time? And quite honestly, to ensure that it's organic and authentic to the community, to some of the organizations that have been living and serving for a long time, might not be sophisticated, so that it really can be, authentic to that community, and ensure that, not, easily, like in mental health, you could have, a for-profit business model come in and try and serve that to every community rather than having the authentic organic growth. And so, I know you need both. I'm not saying anything negative against for-profit entities, but, just how do you ensure that community capacity is, in some of the areas that don't necessarily, we're doing this throughout the state, making sure that communities have the infrastructure that they need to sustain this.
Yeah, so let's dig deeper on that. So I'm relatively new to Medi-Cal. I've worked, my day job is in home care, and Medi-Cal is relatively new for me. But I've seen, and I want you to talk about this unprecedented investment. Mm-hmm. You mentioned these authentic community-based provider organizations, or CBOs, community-based organizations. So one of the things I was hoping you can briefly touch on, maybe like 30 seconds to 60 seconds on IPP, but maybe more so on this path or sited funding. Can you talk about how these authentic ground level folks are getting funding for like the first time ever? And where's this money coming from?
Yeah, no, it's really exciting. And there's lots of pieces to this. So it's really, led out of Department of Healthcare Services within California. So kudos to them for the vision and championing this, because there's a lot of people that have seen this for a long time. And so there's multiple ways, that the funding is coming down. And so the IPP, or the incentive payment program, is, through the managed care plans. And they're really looking at how do they support those providers that are providing. When we say community supports, it's before they called it community support, they called it in lieu of healthcare services. Yeah. And that's, what are the things that, so often we would see people come to the emergency room because it was the safety net in the community.
Yep.
Whether that was because they were unhoused, maybe there was domestic violence, there was, you name it. I challenge anyone to sit in an emergency room on a Friday night and study why people are really there. Yes, they're manifesting, with clinical symptoms. But, so often it's because they're isolated alone. They don't have the services they need at home. And how can we create that? And so the managed care plans are really helping to support, those community-based organizations that, just like we said, through, whether it was the faith community or a not-for-profit organization that has been providing this with, the dollars and to, one, build the delivery system infrastructure. Look at how are they, looking at capacity building for either community support or ECM, and then quality and reporting to make sure that we're not just investing for the sake of investing, but investing for the sake of outcomes. Yeah. But that doesn't happen overnight. So those funds are for the individual organizations, and then, also for the infrastructure and capacity. So PATH is now coming in, and a lot of the funding is coming through the counties, not through the managed care plan. So I'm gonna talk really high level because a lot of this is someone says they're an expert on CalAIM and all the run because we're all learning together, and I think we really need to be truthful and authentic to that. But PATH is, providing access and transforming health. So this is, the biggest thing is you need an acronym dictionary
Yes.
to get through half of this stuff.
Yep.
And so what we're calling cited capacity, infrastructure, transition, expansion, and development is now coming through for, cities, counties, local government agencies, hospitals, community-based organizations, Medi-Cal Tribal, and other, community-based organization approved by the Department of Healthcare Services to be eligible for that funding. So that's coming out. And then you also have, what they call HHIP, and that's the homeless incentive plan. So there's multiple, strands of funding that are coming down for various entities to really help create that ecosystem for communities to thrive and not struggle. We saw a lot of people have been struggling after before, but the pandemic really accelerated a lot of that. And then also looking at populations that perhaps are disproportionately impacted.
Yeah, it's been very interesting. I want to go back to what you said about the authentic, and again, nothing against big corporations.
The community wisdom that they have is just, priceless. Yeah. And then how do we balance that with, some of the reporting infrastructure? So it really is a balance, Gavin, between, just ensuring that we have just integrity in what we're investing in. That we're investing in the right things for the right reasons.
A lot of these folks have more of those relationships with these members that really need the care, and they have a stronger ties to the community. And the cool thing is about this funding you're talking about, and feel free to touch on this as well, is the state will provide not just the money, but the guidance to do this reporting that they've never done before.
Yeah, no, but I mean, it's that we're all going to need kind of mentoring, learning from each other, because I guarantee you that there's a ton to be learned from everyone, on that call. And it again, going back to what the roundtables are, is to really learn from each other, because not to be offensive, but the great man theory is dead. That one person has all the answers just doesn't exist. Yeah. And I've been doing this for 35 years, and I try and always have that humility that, what do I really know?
Yeah, definitely. So the roundtables, for folks that are listening or watching, and they're like, okay, so I'm interested. Is there a website, or how do folks get connected to these roundtables?
Absolutely. So, they're not throughout the entire state yet, but the CalAIMroundtables.com is, a spot where you can see the majority of them throughout the state, and, their monthly schedules and how to get connected and actually to be on the distribution list. So we invite, anyone that's really interested in, being a part of the conversation and the solution of, how we really implement CalAIM to serve.
Yeah. And I encourage folks, just to touch on what Dora just said, definitely participate. I've attended a few that Dora and her team have led, and there's always opportunities for me, for the most part, throughout the hour-long discussions for me to jump in, at the right times or make a comment in the chat. I've engaged with Dora during these roundtables. So encourage you guys, if you're interested in CalAIM or being a community supports provider or ECM, enhanced care management provider, definitely check them out. There's a bunch with different regions that you and your team lead quite a bit of those. One thing I wanted to ask, these roundtables, so these counties that you're supporting and helping to facilitate, you mentioned you've never seen so much collaboration before. Often these counties have competing health plans that you're kind of representing, and they're all working together. So is it always easy? Like, because what I see on the when you guys are game time, light switches on and lights, camera, action, everything seems pretty good. But behind the scenes, is it always hunky-dory, or that you guys have to hammer some things out?
Yeah, well, I mean, it's unprecedented collaboration. Honestly, like I said, I've been doing this a long time. I've never seen this level. But I think the health plans really know that if we're going to do this right and we're going to, have sustainability with all this, we have to work together. And, it's great to have competitiveness, in a lot of the work that we do. But in terms of serving the community and creating that infrastructure, if we're not working together, in that pre-competitive line of creating that infrastructure that's necessary, then no one will thrive. And I think there's a realization. I've worked with, when they needed the workforce with like IT. You saw a lot of competitive schools come together and really say that, if we don't have the talent to, feed the pipeline of some of our jobs, then none of us are going to, be able to work together. And I always thought of that's a great parallel to, if especially, communities that are socially complex and have so many needs. I mean, if someone thinks they're all that and they can do it all by themselves, good luck. God bless them. But that hasn't happened. And I think there's, people that have worked in this, it's interesting because I think I pretty much know 70% of the people that are working in this because, there's been a lifelong commitment, and whether they're working for a health plan, the county, people that really care about this know that.
Yeah, no, well said. So as we wrap up, and we're August as we're recording, and this will be released possibly September. In the last year, because I know you've been doing CalAIM stuff prior to go live, right? January 1st. What would you say is, like, besides the amazing collaboration, what else has been, I don't know, mind-blowing is probably not the right phrase, but what surprised you in this year or so since you've been doing work with CalAIM?
I think the speed at which things are moving forward. So many times you're sitting there and you're waiting as like, okay, when is this going to happen? When is this going to happen? But there is, people are moving and it's not a time to twiddle your thumbs and, it's a time to roll up your sleeves. All that research that academic health centers have been working on and all that we know about vital conditions and social conditions, everybody that's been doing community-based participatory research, it's time to act. And I think that that's what's really been surprising, and it's scary and it's exciting.
Yeah.
And I think, now is the time. I don't want anyone to forget that this is advancing and innovating Medi-Cal. We need the brightest minds, the brightest talent, and the most ethical, socially responsible hearts engaged. And I know that our next youth really cares. I mean, our future generation really cares about, what are we creating? And, I know I care deeply about the communities and the systems that I'm leaving my kids. Now's the time. Don't be discouraged and, listen to the news and think it's all doom and gloom. We have enormous challenges in front of us. But going back to my dad and planting that seed, they broke the sound barrier after they'd gone through all World War II and the Korean War. They had been beat up, but believed that the human condition can persevere. And, I want to encourage us all to be in that space and to tap into that ingenuity and innovation.
That's great. And to echo what you said, Dora, a lot of these health plans or the state is willing to invest in, so the providers that are listening who don't know the answers, who think, well, I don't know, they're not going to want me. You might be surprised.
Right.
We need you.
We need you. We need you. We need you in the conversation and talking about what's possible. Yes.
And I just want to affirm that, because like I mentioned before, my day job, most people know by now, we are a day provider. We have hardly any of the answers, and neither do the health plan partners, but they admit it. And so we work together. We're less intimidated. We're not intimidated by these big, bad health plans who have all the answers. No, they're very open, and they want the feedback. So it's been pretty cool. I've been doing this 20 years. And like you said, I've never seen anything like it. I joke with my friends in the industry, we're often the subordinate vendor, or like the providers are often the subordinate, or they may think they're the subordinate, but we're not. Yeah. We're the strategic partners, right?
Yeah, absolutely.
Yeah. So, sorry, I get on my little high horse and tangents sometimes.
No, I'm with you. That's where we need to tap into that energy of creation and what's possible.
Yeah. Well, Dora, I really appreciate you being on the show today. Dora Barilla has been our guest, who co-founded HC2. But tell us the whole name again.
Healthy Connected Communities.
Healthy Connected Communities. And if folks want to learn more about your organization, Dora, or reach out to you, can you tell us your website and how to connect?
Certainly. HC2 Strategies.com. And they can go on the website, and there's multiple ways to tap in. And we'd love to hear from you if you're, interested in, being a part of the solution.
Awesome, Dora. Well, hey, thanks again for joining the show today.
Thank you, Gavin. It's been a pleasure.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.